Toddler development, ages 1 to 3 years old. Introduction. What is toddlerhood? Toddlerhood is critical developmental period occurs from ages 1 to 3 years old. It is characterized by rapid physical, cognitive, emotional, and social changes. During this time, toddlers gain independence in movement, communication, and self-care, yet they remain dependent on caregivers for safety and guidance. Between the ages of 1 and 3 years old, toddlers experience steady physical growth and visible changes in body proportions. They typically gain about 4 to 6 pounds and grow 2 to 3 inches annually, with most children reaching approximately half of their adult height by the end of the stage. As the growth continues, their appearance transitions from infant-like to a more childlike form as body proportions stabilize. Head circumference is routinely measured until age 2 and afterward only if neurological concerns are present. Gross motor milestones typically include taking independent steps around 15 months, walking and climbing independently by 18 months, running and kicking a ball by 24 months, jumping with both feet by 30, and riding a tricycle by 36 months. Fine motor development follows a similar progression, beginning with stacking two objects and finger feeding at 15 months, scribbling and drinking from a cup at 18 months, and using gestures in both hands together by 24 months. By 30 months, toddlers often turn knobs and begin undressing, and by 36 months they can string beads and put on some clothing.
Expected vital signs for a toddler ages 1 to 3 consist of a heart rate of 80 to 140 beats per minute, a respiration rate of 25 to 30 breaths per minute, temperature of 96.8 to 104 degrees Fahrenheit, and then blood pressures vary based upon gender. Males will have a blood pressure of 85 to 91 over 37 to 46, and then females should have a blood pressure of 86 to 89 over 40 to 49. Pulse may be taken at the brachial or radial artery. Apical pulse is often used if irregular. Respirations are typically abdominal, and toddlers may breathe irregularly at rest. Blood pressure is measured using a cuff appropriate to the child's arm size, and temperature can be taken axillary, tympanic, or older for older toddlers. To use therapeutic strategies while assessing for vitals, explain to the toddler what you are using and an appropriate age language. You can use play, allow toddlers to check out tools such as the stethoscope, thermometer before use, and you can also demonstrate on a toy or a parent first. Provide comfort items such as a favorite blanket, pacifier, or stuffed animal. Distraction techniques may also be useful, such as a song, bubbles, or videos. Allow the toddler to be present in the guardian's arms using a calm voice. Work quickly while providing positive reinforcement and praise after each step.
Social development. At this age, kids engaged in what you call parallel play, where toddlers begin to play alongside, but not directly with other peers. By the age of 2 to 3, they start imitation and simple pretend play, where they continue imitating others and participate in simple pretend play. This increases emotional awareness as they recognize their own emotions and those of others, and they are able to respond to the emotion of others. And at this stage, we can also advise caregivers to give comments like you look happy, stacking blocks, to help toddlers connect feelings with words. Language and language development. Language develops quickly from 3 to 10 words at 18 months, to 2 word phrases at 24 months, to over 200 words and simple sentences by age 3. Understanding increases. They can follow simple instructions and point to name objects. And at this point, when they are able to point and name objects, we can tell the caregivers to try and focus on shared book by reading and verbal, turn-taking, conversation. Minimize screen time in favor of interactive dialogues. And then also this will help develop language skills and active listening.
Emotional development in toddlers. They gain independence. Toddlers begin to explore and show preferences and assert their own choices. They develop strong likes and dislikes. They will show negativism, which they may refuse or do the opposite of what is asked, which is a normal part of asserting their autonomy. They'll experience temper tantrums, which are brief emotional outbursts caused by frustration or inability to communicate needs. These will typically decrease by the age of 3. They'll experience regression, which will temporarily return to earlier behaviors such as baby talk, incontinence, pacifier use, which can often be due to stress, illness, or routine changes. In sibling rivalry, increased tantrums, frustration, or attention-seeking behaviors when a new sibling arrives, and it can be eased by allowing the toddler to help with baby care or providing designated one-on-one time with the toddler. And they will have limited self-regulation, which is normal at this stage. Toddlers will gradually develop better emotional control over time. Toddlers require 180 minutes of active play daily. Approximate play consists of running, climbing, which can contribute to muscle and bone strengthening, memory and sleep, which can reduce risk of health concerns. In total, these areas are essential in aiding healthy growth and development promotion during the toddler age. Children can use resources such as parks or any other resources to induce this play. In toddlers, dental care should begin as soon as teeth erupt, which consists of brushing twice daily and flossing. First dental visit should be done by 12 months in age. Dental health in toddlers is important to prevent childhood caries, support proper chewing and nutrition, promote speech development, and establish lifelong dental hygiene.
The child should receive multiple vaccinations as a toddler to support and improve their immune system. Between 12 and 15 months, the child will get the third dose of poliovirus, influenza type B, and pneumonia vaccine, as long as varicella and MMR. From 12 to 23 months, they will get a hepatitis A vaccine, and then from 15 to 18 months, they'll get the diphtheria, tetanus, and pertussis vaccines. From 12 to 36 months, the toddler can get the live influenza vaccine and the COVID-19 vaccine.
Toddlers can ingest medications, household cleaners, or unsafe items, so we must store all substances locked and out of reach. Lead poisoning, there is no safe level of lead exists for children. Even small exposures can cause neurological, developmental, and behavioral problems. Lead-based paint homes built before 1978, contaminated water, soil, imported toys and food, and occupational exposures. Risk factors, toddlers' mouthing behaviors, crawling, incomplete blood-brain barrier, and iron deficiency, anemia are all risk factors. Toddlers are at a highest risk of drowning. It can occur in inches of water like bathtubs, pools, and buckets. Prevention, constant adult supervision, locked gates or fencing around pools. Never leave a toddler unattended around water. Choking, foreign body aspiration. Some common foods and objects are grapes, peanuts, popcorn, coins, and toy parts. Prevention, cut foods into small pieces like grape quarters, hot dogs into strips. Supervise eating, avoid distractions, and avoid high-risk foods. Teach parents to supervise toddlers while eating, and then parents should know CPR and choking response, but never perform a blind sweep. Toddlers are at an increased risk of falls when they learn to climb and walk. Prevention, use safety gates, secure furniture, supervise at playgrounds. Car seat safety, toddlers should remain rear-facing until at least 2 or until they meet the manufacturer's height and weight limits. Transition to forward-facing only when appropriate. Burns and sunburns, like hot liquids, stoves, fireplaces, outlets, and sun exposure. To prevent this, we would set the water heater to save temps, use outlet covers, keep hot items out of reach, supervise closely in the kitchen, and then sun safety, limit midday exposure, apply sunscreen, and encourage protective clothing. Red flags for toddlers for developmental would be not walking by 18 months, no words by 15, or no two-word phrases by the age of 2, loss of previously learned skills, poor eye contact, or little interest in play. Another red flag would be abuse and neglect, unusual bruises or pattern burns, fearfulness around caregivers, poor hygiene, malnutrition, or untreated medical issues.
Toddlers can be picky, so encouraging a variety of foods that are colorful and they can eat with their hands is a good way to encourage them to eat different foods, and their serving sizes should be 1/4 to 1/3 of an adult portion. They should drink 16 to 24 ounces of milk a day. For sleep, toddlers should get 11 to 14 hours, including a nap. Bedtime can be a challenging time because they have nightmares and can resist going to bed, so having a calm bedtime routine is important. As talked about before, toddlers may refuse to brush their teeth or want to do it themselves. This can lead to teeth not being cleaned properly, so making sure an adult helps floss and brush their teeth is important to improve dental hygiene. Establishing the family dentist by 1 year old is also important. For nutrition, the child should be provided a variety of foods to fulfill the My Plate. The nurse can provide information on food and suggest diets based on physical exam of the child. For skill development, the nurse should also assess running, jumping, and saying words to make sure they are hitting the milestones they should be by this age. If they are falling behind, it would be useful to provide the family with information and other support services that can help their child achieve these things. Toddlers love putting everything in their mouth, so making sure they cannot get into chemicals and medications along with cutting their food into smaller bites is very important for the child's safety. Other safety issues that need to be observed is hot stove and falling down the stairs. A nurse is observing a group of toddlers in a playroom. Which behavior indicates a typical development for this age group? A. Sharing toys and taking turns with peers. B. Playing next to another child without direct interaction. C. Organizing rules for a group game with peers. Or D. Sitting quietly and watching older children play. The answer is B, because toddlers typically engage in parallel play where they play alongside their peers. The nurse is assessing the developmental milestones of a 2-year-old child. Which observation would be expected? A. The child engages in complex role-playing with peers. B. The child initiates household activities during pretend play. C. The child constantly controls emotional outbursts and frustration. D. The child prefers solitary play and does not notice other children. The answer is B, because by age 2 to 3, toddlers begin simple pretend play.